Ooh, that slow fade in, man. That's about how I feel right now. That slow fade right now. How you doing, everybody? Happy Thursday. Happy for making it. And congratulations for making it to another Thursday night. I am Keith Johnson. I am your host tonight for Invisible No More here on the Eclipse Pain and Recovery Network, where we, the patients, get the ability to wrap up, excuse me, 3 nights of people who are true licensed professionals talking about different healthcare things. And we get our chance, this is our opportunity to get our side of the story out to not just Dr. Leek or Jose or to Katie, but to the world about what it's like to actually be a chronic pain patient or somebody with a chronic illness or somebody who's struggling with mental health. Because that's really what invisible is, right? We're people that are dealing with an invisible diagnosis. Something that when you run into your friends at the grocery store, they don't see what's wrong with you. And if they don't see what's wrong with you, they don't see the battles that you're fighting. And why does it include people with chronic pain, people with mental health struggles, and people with chronic illnesses? It's because we all tend to fight the same battles. With doctors, with care teams in general, with hospitals, with insurance companies, with our friends, our family, and at times even our partners, our spouses, the people that really mean the most to us. We've had the same battles with insurance companies. We've had the same battles with partners. We've had long talks with our kids about why we can't go to the game this weekend, even though we desperately want to be there. We've lived it. And by sharing our stories, by letting others know what we've done, whether it worked or it didn't work, others can pick pieces out of it and try it themselves. And ideally, we'll share some victories at some point and people will try some of those. And we've documented in the past where people have heard somebody say something and then they've applied it to their situation and they've had victories themselves. That's the community. And I'm excited to talk a little bit later on tonight. We're going to start changing some things up here on the network, and I'm going to get to bring community really back in full force. And as much as I love monologues, I miss talking to you guys as much as we do on the other lives. And next week, I've invited not one, but 2 guests. You know, Katie had one on last night, Dr. Silber. And if you missed that episode talking about betrayals and in healthcare and how it can affect us and affect our health, man, it's up there right now here on the YouTube page. I would highly recommend checking it out. The comments last night were kind of sparse because everybody was hanging on what was happening on the screen.
Floored.
In the conversations.
I mean, she had me diagnosed down
it wasn't,
to the T.
It wasn't just you, brother. I was getting comments, messages on WhatsApp last night or in different social media talking about how it nailed them and how it was going to help them fight and where they're doing, what things they're going through now.
Truly. You know, I left that whole conversation really asking myself, am I in a 3 or a 4?
Yeah.
Because I don't want to be stuck in an internal 3.
No, nobody does.
Right.
And so, yeah, I mean, it was that good. So if you get a chance, it's about 45 minutes to an hour long last night. And you can just get it started here on YouTube and just let it play when you're walking around doing stuff around the house if you need to. But I think what'll happen is you'll find yourself sitting down and listening to it because there's so much good information. But that's what we do here on this network as well as Invisible in general. Starting next week, we're bringing a lot of the community back to Thursday nights. I've invited 2 guests on, 2 people that would have never met without Invisible. And through the Invisible connection, one flew from small town on the East Coast to big town on the West Coast, spent a week there, had one of the most incredible life events that could happen. And they got to do it together as Invisibles. And that never would have happened. That experience together with them would have never happened without Invisible No More. Nothing I did. Y'all, they watch the lives. They understand how important community is. They started talking. They did start volunteering with Invisible, but it wasn't anything that I did. I didn't snap my fingers and say, hey, why don't you go do this? No. It was all natural and all organic, and it was just a beautiful thing. So, but we'll get into that later here in a little bit. Tonight, we're going to talk about insurance, and I'm going to try my best, my very best, as long as my computer will hang, take the glasses off, to keep track of everybody's comments tonight, because I want comments. I'm going to try to catch. And just remember, if you type a comment, it's going to be 7 to 10 seconds before I see it on my screen here.
And I got your back.
So, and then Kevin has my back. Evelyn's here. They're probably watching as well. So if you have something that you need to get out, say, hey, Kevin, I need to get this, or hey, Evelyn, I need to get this. And they'll make sure that I catch it. Because I think tonight, a lot of this conversation, a lot of what I've got, again, it's going to help validate lived experiences. I think that just about everything I've got in the presentation for you tonight that I worked on, that Jennifer worked on so hard, are things that about every invisible can relate to, even the oddball stuff, right? So like I've said before, Dr. Leek has this beautiful plan set up for all these 12 weeks. And he starts every week has something he calls a belief that's being violated. Belief violated this week is care decisions are clinically neutral, where we're introducing the truth of incentives shape outcomes and apply insurance to that. And you can see how deep we're going to be getting here. Early this week, Dr. Leek questioned the belief that healthcare decisions can be made purely on what's best for the patient. Right there, I think we just nailed about 95% of the people that are watching. Have you ever walked out of your doctor's office after an appointment and really felt that every single decision was based on what was right or what the insurance company was going to approve? It happens to me now, because the things that are right, but it still happens on what insurance will allow to happen. Policies, procedures, right? He talked about how insurance with its rules and pre-authorizations and appeals, et cetera, and how the system is actually designed and can affect patient care, all the way down to how much time you can spend in the exam room with your doctor. Earlier this week on Monday, Dr. Leek basically put it out in pretty bold language, because remember, I'm not sure if you saw it. Again, if you didn't, he actually puts up graphs on how much doctors get reimbursed for some procedures and stuff, including nerve stimulators. But he talked about how it's almost to the point that for a doctor's clinic to be successful, it's 15 minutes per patient.
And they got to see everybody.
Yeah.
A bunch of people.
A bunch of people. And so they got to get 4 patients an hour minimum. And so it goes to drive home why I preach, why Amy preaches, why anybody that you've ever associated with Invisible No More preached to do everything we can to establish that personal relationship with your doctor. Because the more they know about you before you walk into that exam room, that helps with if the visit is only 10 to 15 minutes, because they know what's worked in the past. Excuse me. They know what hasn't worked in the past. They know what you're able to do, what you're not able to do. They know the home environment that you're living in that may or may not have an impact on what kind of PT you can do or what kind of meds you can take. All that knowledge comes built in when you walk into for that appointment, if we're able to get a relationship with our care team, whether it's a pain doctor, a neurologist, a gastro, arthritis doctor, whoever it may be, PCP. And again, I know that's not always possible. Please, I know that. But if we can at least try. I had a gentleman post a TikTok earlier, or late last week or earlier this week, where he was able to write down things that he wanted to get out to his doctor. And he actually got them out. And he said that was one of the best appointments he's ever had with that doctor. And he's been seeing that doctor for years. All because he was able to take that note card in with the things he wanted to get out to him. And they're starting this better relationship now after all these years because they were able to get that stuff out. It can be something as simple as that. Insurance also, they're the gatekeeper, right? For not just preventative medicine, but for treatments and medications and supplements like my insurance. I'm not going to mention who they are, but they don't cover, they're a gatekeeper when it comes to my opioid medicines. They don't pay for them. That's a cash payment every month that I have to make when I go to the pharmacy. It's $85 a month for me to pick up my pain meds. It's another $115 a month for me to get the ketamine that I take as well. That helps with pain as well as the mental aspect of it. So that's $200 a month out of my pocket, out of a person who's living off of $900 and change on disability. that I'm covering because they're gatekeeping and saying that opioids are not an approved treatment method, so they won't pay for it. So we're going to talk about tonight what it looks like when you're trying to get care. And again, a lot of this tonight is going to be validation, I think. So if somebody's new to Invisible, I think a lot of this stuff, maybe it's some of the very first time that you've realized you weren't alone when you fought this stuff. Because see, I call it the insurance treadmill, fighting for access instead of fighting for getting a better quality of life. We have to fight at times for treatment that will help us get a better quality of life instead of just fighting to get a better quality of life. It's very, very frustrating. And if you're an invisible, or if you have a chronic diagnosis of any kind, I think you know what I'm talking about. See, to start with, insurance just really isn't an optional thing, right? Because paying out of pocket just isn't realistic. I would love for my personal care team to be a cash only basis, because I think my care team deserves it. But at the same time, if that switched to that, I couldn't afford it. I'd have to go elsewhere, because I can't write that check every month to come see him versus what I pay when I come in with insurance. So whether you're covered under an employer plan, Medicaid, Medicare, we have to depend on it. And there are alternatives like concierge services, direct care, right? Functional medicine. But insurance, again, has become the gatekeeper. And I feel like once we get inside that system, they control everything, including the pace of us getting a better quality of life. We're not managing symptoms anymore or managing care anymore. We're managing the insurance company as well as our systems. So we also manage approvals and pre-authorizations, appeals and denials, resubmitting documentation that we know our doctor has submitted multiple times already. In the denials, it's not just a river in Egypt, y'all. It is very severe.
I like how you did that.
It's not, right?
You're right.
A major healthcare company got busted not too long ago because the AI that they had decided to use they got caught because the AI was denying nearly every single thing that was submitted to it because it was faulty. And then they ended up paying like a $3 million fine and said, we'll never do it again. But based on those denials, the head honchos got millions upon millions of bigger bonuses because they didn't have to pay out because of the denials, because they know, unfortunately, that I want to say it's like 32% of people who get denied the first time don't appeal it and keep fighting it. So they're cutting 30% off the top right there.
Wow.
So, and I could be wrong about the percentage. If somebody knows the right one, let me know, because I want to be correct. I don't want to be giving out false information. Forky said, I found many insurance companies have social media managers and look for posts on X if you tag their insurance company. When my med was getting denied, they actually helped. I wish that would work for me. Unfortunately, when I had to renew my insurance this year, I looked around, and this plan I'm on is the best one for me besides the meds. My insurance will approve an opioid. They'll approve, I think it was Oxy, like 5 milligrams for 4 days at 3 times a day. And that's it. They won't approve it for a chronic situation. So just unfortunately where I'm at, but unfortunately that's what works best for me. So I can see my current care team, and for the hospitals that are closest to me, that's the best policy that I had to go through. See, I feel we spend more time navigating insurance than focusing on getting better or having that better quality of life. And remember, y'all, it's not just us that's fighting the insurance game. It's our care team. They're doing the same. Dr. Leak talked on Monday that like 15 to 20% of his overhead in many practices, I should say, is just people dealing with billing, authorizations, and collections. Clinics are having to put out that extra money just to deal with the insurance companies. So while we're fighting for coverage, our doctors are fighting to get reimbursed. And it's just another example of insurance being structured and shaping and deciding our care. Because like I mentioned earlier today in some social media posts, I feel like as a chronic patient, at best, according to insurance companies, we're a small paragraph where they explain the cost benefit analysis they did on us. Is it less expensive to give them this treatment, or which is cheaper, give them the treatment or just let them suffer?
Isn't Donald Trump doing something, having them disclose something? I forget. I know.
I don't know, man.
Yeah, there's something that I heard recently where now everybody has to disclose what their profit margins or something like that looks like.
You're supposed to be able to find out the cost and what people make on stuff, right? But at the same time, you still have to get it approved.
Right.
And that's the battle.
Right.
The battle isn't for on the patient side, it's getting it approved, and for the doctor side too, getting it approved. But then once they get it approved, trying to get payment out of it, right? Because again, on the clinic side, upwards of 60% of what a clinic takes in is taken up on an overhead. That's outrageous. That is outrageous. And while costs have gone up by that, let me rephrase that. It's not 60% overhead. I read my notes wrong. Sorry about that. What I meant to say, overhead costs have gone up, right? That much. Insurance reimbursements have gone down. So if overhead is at 60%, climbing and up, and reimbursements are going down 30%, you see the problem.
You're trending in the wrong
direction, right? So if the obvious question is, if costs continue to run more than their practice and patients are paying more into the system because everybody's insurance is going up and doctors are taking home less money, where's the money going?
Somebody's pocket.
It's because they manage everything,
yacht.
Right?
Correct.
You know, it's, they said, I guess Evelyn says it's 60 to 70% overhead and climbing.
Wow.
It's outrageous. Think about it. One mega insurance company, right? They do the healthcare, or they manage the healthcare, right? Then they manage your pharmacy benefits, so they get a cut there. Then they own their own pharmacies, so they get a cut there. Now they're owning clinics as well, so they're taking the money in there. And so it's all encompassed. There's one conglomerate insurance company that's taking it from your premiums to Medicare premiums and everything like that, and just keeping it all in house.
And if they're not taking it, I mean, look at here what Kimberly's saying. She spent 2 weeks trying to get her doctor, I guess, to get her neuropsychodiosis. I hope I got that right. But just to get it approved. Meanwhile, she's still swelling.
Yeah.
Brain swelling at that.
Yeah. You know, I think, well, I got a message from somebody this past week, up in Virginia. There's a cardiologist office that specializes in kids, right? Think about that. Number one, the fact that children need their own cardiologist. That to me is scary as all hell. Imagine being a parent to these kids, right? They're closing their doors.
Yeah, it becomes
because they couldn't make any money.
Right.
So now these parents have nowhere to go because they weren't even referring them out to other clinics because there is nobody to refer them to. So some families are going to go from like a 30 to 40 minute drive to 2.5 hours to get to, if they can get into another specialist somewhere else for their child. It's because of that 60% and going up, and then reimbursements dropping through the floor. They can't keep the doors open.
Did you see what just popped in? And by the way, big business is buying up doctors, restricting their free ability to practice. Small private clinics going out of style. So not only are you having to drive, but there's very few left for you to drive to.
It took me an hour and 45 minutes to make it here tonight.
Yep.
One way.
Wow.
Right.
Glad you made it.
So am I.
Glad you're here.
So am I, you know.
But that's just the reality of the situation right there.
Carol. I love Carol. When you research the insurance bigwigs, I'll never understand why you need more than one yacht.
She's right.
Well, Kimberly says she drives 3 hours to her pain management doctor in one way. But you know, Valerie has an appointment with a neurologist specialist coming up that we're going to have to drive up the night before and get a hotel room, right? Because it's that long of a drive to get there.
Do they cap out the limits, the like radiuses as to how far a doctor can see certain patients?
For me, my cap is regarding the pharmacy.
Okay, okay.
So, and that's what's capping me. Actually, I need to come in. I have to stay in state of Texas, but I don't think there's a regulation, at least under my insurance plan right now, that prevents me from driving to Houston if I had to. Right.
And picking up your prescription down there if you
Right.
need it?
Well, no, I can't pick a prescription in Houston, but I can go to a doctor in Houston, and then they could
Okay.
call they could send the meds into my local pharmacy.
Gotcha.
But once I get outside of like a 50-mile radius of the pharmacy, that to pick up meds, that's a red flag.
So you have to live within a certain radius of just the pharmacy.
Yeah.
Oh,
Dude, our pharmacies, our scripts, if you're a chronic pain patient, your scripts are washed like a hawk, man. How many MME are you on? Your morphine, oral morphine equivalent, right? The 2016 standard is set at what, 20? That's 2016 guideline was, before that was like, what, 90 MME? And
and what is that like equivalent to?
Let's say 4 to 5 oxytens a day
Gotcha.
would be in the ballpark. So once if you're at 90 or below, according to those guidelines, which are supposedly no longer in effect, but so many chronic pain doctors still quote them, and this is why I can't write you more 90 MME. But once you got over that, then everything was washed even further, and doctors were hounded even more. Why are you writing so much pain meds to this person?
Wow.
So even though they've taken that away, it's still a focus point, you know. Trying to see if I missed anything. Kate said I've had to travel over the country to get care. Yeah. Many of ours are over 3 hours away, and Kate unfortunately has gotten terrible care that far away. I don't know. I must have said something wrong because Carol said I'm sleeping on the couch tonight. Forky's, where are we at? Robin, I drive 2 hours to my doctor one way. Yeah. You know. So, and Robin said when I have procedures, I have to sleep there the night before. That's interesting. We were just talking about that tonight because if I have procedures, I'm going to have to do the same thing. I have to spend the night wherever the hospital is.
Right.
You know. So, all this time these doctors are putting in, wanting to see us, wanting to spend more than the 15 minutes in the room with us. They're having to spend time on paperwork, billing systems, fighting for reimbursement. I can remember when I came in to do podcasts one day on a Friday with Dr. Leak, and in between questions that we were answering, he was on the phone. He was continually walking out because of HIPAA rules and stuff, because he was fighting for somebody to get care. He took the entire day off the practice so we could do that, but yet he was still having to answer phone calls for insurance companies and talk to doctors for the insurance companies to try to get people
I remember that.
care.
I remember that. He stepped out quite a few times.
Yes. Yeah. One question I didn't get to ask him on Monday when he was talking about that is how many people are on the payroll on an average clinic that just deal with insurance?
That's a good question because you're basically putting together a small army to combat the system.
Yep. And I would imagine that those people are poached pretty regularly from a clinic, because if they're good, every doctor's going to want them.
Right. That's how you get paid.
That's how you
wow.
get paid, right? I guess if you're really good, you would base your salary on your approvals and how quick you're able to get paid. So, just a thought. So, Evelyn, I guess, said 2016 guidelines were interpreted as mandates. They emphasize not mandates, but the standard of practice remains. It takes heavy documentation to justify the risk-benefit ratio for treatments above 90 MME. even though that's no longer in existence, supposedly, doctors are still getting flagged. Why are you giving this patient more than 90 MME? It's because they need it. It's not about an addiction issue. Nobody wants to take these stupid meds. It's because we're just trying to get some kind of quality of life. I don't want to be normal. I hate taking the trash out. But taking the trash out when you can barely walk is a different level than simply hating taking the trash out. Excuse me. Kimberly said that her doctor had to hire 3 extra folks just to take care of the billing. Carol said my PC office built a whole new building to house just the offices for folks dealing with insurance.
Wow.
That's crazy. That's crazy. I think on our very first one Thursday night, it was a podcast that Dr. Leek and I did. We talked about giving each other grace, about how as patients we need to give our doctors grace at time, and our doctors need to give us grace at time, and that we give what we try to, what we want to receive. My point in bringing that back up, that memory back up, is when we only get 15 minutes with our doctor at sometimes, get what we can get, right? And understand that if they could spend 2 hours, they would spend 2 hours, right? So do what's recommended. Write down the bullet points, the main important things that you want to get accomplished in that appointment, so we can try to get them out in that 15 minutes. So just want to kind of scroll through, see if I missed anything. Other comment that was important tonight. I'm not seeing much. So yeah. And what's sad about that 15-minute time limit is if you're diagnosed with anything chronic illness, chronic pain, mental health issues, our issues are deep, and they're typically more than one. We are typically very, very complicated patients because we have more than one health issue. And that's trying to fit all of our issues into that 15 minutes. And how does my depression play into my chronic pain? Or how does someone's POTS, how do you manage their POTS with their migraines and then the chronic pain from a bad back? How do you, right? I want my doctor to be able to have the time to figure out what meds we can try or what procedures we can try that's not going to conflict with the POTS or conflict with my EDS or conflict with my gastro stuff. But they're up against that limit. I think that's maybe one reason why some doctors are continuously running behind all the time, which I've really changed my attitude on that.
I sure have. I've seen now from just behind the scenes, doctors pull some wild hours.
I used to be a real big butthead. But as my body is falling apart more and I'm demanding more time, I'm understanding why doctors are always running late going into people's rooms, So Jennifer says for a note, sometimes I'll shoot a MyChart message to my doc so they also know what they want to cover. That's awesome if your doc uses MyChart. A lot of times I've heard that docs have it available, but that messages go unchecked or unanswered. And so make sure your doctor is somebody that actually participates, that does more than just offer it, I guess is the way to say it. So, but what I was saying, chronic illness, these chronic diagnoses, they take more time, and the system is set up that time isn't really well reimbursed. I think Dr. Leek said on Monday that there is another code they can put in sometimes to get paid for the extra time, but that's rare. So we're always feeling rushed, right? And we feel like we're not getting the access we need to our care team, but it's because they're on a constant treadmill. Not because they don't like us or don't want us to get better or have a better quality of life, but they're just trying to keep the lights on and keep the doors open. And how do you balance all of that? And this one to me when I was researching it, and when Jennifer was researching it and sent it to me, this next one dealing with insurance just really, really hit home. It's, we have coverage on paper, but it isn't care or coverage in reality.
That's deep.
You know what I'm talking about?
That's deep.
It's true. It's 110% true.
It's almost like fiat.
Here's some examples that some of y'all might have lived. Insurance says something's covered, but try finding a specialist with availability that's not a 6 to 9 month to 12-month wait to get into them. You have the care. They'll pay for you to see them, but you got to find one. Remember Valerie first diagnosed with something, and they were going through all these things and these doctors and stuff. And she called and they're like, yeah, we're taking new patients. Yeah, we can go ahead and get you scheduled today. And the excitement's building and everything. 12 months to the date Valerie called was when they were scheduling. But we'll keep you on a long list of patients in case we have cancellations, right? Then you have to find a specialist that'll even take your insurance, or one a clinic that's even accepting patients, because so many specialists are already tapped out. Docs and clinics can only take so many patients. 800, 900, 1,000? How many more can a doctor take and adequately manage and do a good job of it? I don't have that. I don't know that answer. I'm just throwing it out there. And as a chronic pain patient, it scares the hell out of me, because we were talking on Monday night, listening to Dr. Leak talk. There's nobody going into pain management. There's very, very few doctors that are graduating from med school intentionally going into pain management.
Shrinking.
And what are we going to do? There's not enough of them right now to take care of all of us out here. A lot of these doctors have hundreds and hundreds of patients, and there's not new ones coming out. And it's all because of, my opinion, and maybe Dr. Leak and I can argue about it, but I think it's government interference. It's insurance company interference. And it's the fact that some patients, to have a quality of life, are going to need to be on an opioid medication for an extended long period, maybe the rest of their life.
And doctors know. They know.
Yeah.
They know that they're going to run into those type situations, and they know the system's built against them.
Yeah. And they also know that the state is going to come in every year or 2 years, and they're going to nitpick. They're going to pick patients, like 20 patients, and they make the doctor explain every single thing that's in that patient's file, and then question, why didn't you do this? Or why didn't you do this? Or why didn't you offer this therapy? Or why didn't you do X, Y, Z? And it's not like the doctors know which patients they're going to pick ahead of time. That's the state picking them, right? So less people come into it because they know they're facing that. It's not like, why did you write this antibiotic for this STD instead of this one? Why did you write opioids instead of, trying them on aspirin for a month? And that's the kind of questions, because it deals with that opioid, which they don't want doctors to write in the first place. Doctors in school now are being told to never write these things. Then they get into the real world and they realize the repercussions of what happens to people if they're not available, right? So yeah, we have coverage on paper, but it's not really in existence, right? Excuse me. So even if we have the coverage, though, we're still dealing with a whole bunch of garbage, like copays, supplements and meds are out of pocket. Physical therapy, yeah, we'll give you 10 visits, and you actually need closer to 20, but they're only going to give you 10. And then for those of us who are still able to work, you're having to travel 2.5, 3 hours to go to a doctor's appointment. You're pretty much taking that whole day off of work. So you're losing income, then having to pay out of pocket for your meds and your treatments in a lot of cases. So you have coverage. It's just at what cost? And is it really coverage? Right? Because I don't think we can talk about insurance without talking about the financial toll that happens along with the physical toll, because we're managing pain, or we're managing our our GI issues, or we're managing our POTS, but at the same time, our insurance is going up every single year. And for a lot of us, costs of medications are going up as well. And when care costs more and lasts longer, the process gets harder to make it through. And here's my conspiracy theory. Can I put my tinfoil hat on? That goes along with us being cost-benefit analysis. The harder it's made to be, the less people will continue trying.
Hence, the more money a company can make.
Yep. Same thing with denials. The more complicated the process is for a patient to get care, the chances increase that patients are going to give up, so there's nothing that has to be paid out. So if it's a computer using AI denying, it's not even costing them anything, essentially, besides electricity, until people give up. And they count on people giving up. My personal opinion is it's hard on purpose. And I can catch flack from it. I'm afraid to see Dr. Leak after the live. I hope he goes home before. Yeah, or he may just take me apart in his live tomorrow for my conspiracy theory, right? So I don't know. Jennifer says, we went from living obliviously comfortable for 15 years to paycheck pretty much overnight. Erica says, my daughter-in-law works at our local very large hospital. The hospital owns the health insurance that's given to workers to buy. Conflict of interest? No. That's just called how we do it. How that gets approval. How the government allows an insurance company to manage our insurance, manage our pharmacy benefits, own the pharmacies that we're being forced to use, and then the clinics that they're making us go, that they're paying the doctors to go see. There is no economy escape. There is no savings there, because any savings gets scooped up by the hospital. You know. Robin said, we pay monthly for insurance, and then we still have to pay the huge deductibles for procedures just to be able to walk. Or co-insurance. What's the crap with co-insurance? You have insurance, you have copays, and now we have co-insurance. So they don't have to spend as much money taking care of us. And while we're fighting this, doctors are still fighting on the other side too, right? We're fighting for access and for access, and providers are just simply fighting to get paid. Care doesn't happen in a vacuum. It happens inside a design system. And that system, unfortunately, determines what's possible. But this goes back to the community that we talked about earlier, because you're not fighting it alone, and neither is your doctor. I firmly believe, and it's a kind of a foundation of invisible, informed patients and informed providers push back better if we work together as a team. And how do we do that? By trying to establish that relationship with our care team, with our doctors. So did I say anything way off base or way wacky tonight? Did I miss a comment that needs to be talked about? Please let me know, because I don't want to give out bad information. I want to try to make sure I'm honest in everything I put out there, Forky was talking about PT being expensive. She says hers is $60 each time, and they want her to go 3 times a week for a month. $180 a week. There's no way I could afford it. I'd be like, what can I do at home?
That's my only question. Can we use my phone and film me, and you tell me what I need to do, and I'll just go from there?
Yeah. And I don't know what the answer is. There was a discussion before Dr. Leak's live on Monday between Dr. Leak and Evelyn. And it was very polite, but it did deal with politics in a certain way. And it was between nationalized healthcare and capitalistic healthcare, which is better, pros and cons.
Sensitive subject too.
Yeah, I don't want to get deep into that tonight. Because I don't have the answer, because what's better, to live in Canada and wait a year and a half to see a doctor, or to have our care and wait a year and a half to see a doctor. I don't know which is better. I really don't. I feel our care is being determined by somebody who has no idea what we're going through. I feel like I read an article one time that a doctor wrote. It was an orthopedics doctor. He was wanting to do surgery on somebody's knee, and he got into, what do they call doctors who do like skin? I can't think of what they are.
An epidemiologist?
I can't remember what he said he was.
Chat, help me out here.
But the guy that was the doctor for the insurance company didn't even understand what the surgery was about. And when the ortho was explaining what they were going to do, the name of the procedure and why it was important, the guy didn't initially think that it was a real procedure, and then determined it wasn't important. And the ortho was livid, and rightfully so, because this doctor has never seen the inside of a knee who's telling him no. He can't understand what he's talking about, but he still has a position of power to tell the doctor that knows the patient needs it no. So, dermatologist, I guess that's what it is. I can't remember. Yeah.
What did I say? An epidemic?
Yeah, I don't know. Kimberly says peer-to-peer review, but it's not peer-to-peer. I don't understand how a pain doctor would have to talk to a cardiologist about a nerve stimulator when the cardiologist typically doesn't install those to control pain in somebody's body. It seems to me it need to be a pain specialist talking to a pain specialist that represents the insurance company, and let those two duel it out.
You would think that would make sense. But seemingly in our system and in our society, what makes sense don't make sense.
No, it doesn't make any sense, right? But it's justified, and it's accepted as normal.
And that's a great idea. A doctor with the insurance company.
Well,
Doctors speaking to doctors.
Well, they need to be the same specialist.
Right.
Right?
I mean, we sat there and we watched Dr. Leak. He was basically battling someone that I guess thought they were the doctor.
Yeah. Somebody that knows your care only by what they read in the charts that's been done to you so far. They don't know what's going on. They don't have a true image of what's going on. You know. And Carol said they have pharmacists and chiropractors making insurance decisions. Yeah. I don't know. I don't trust a lot of pharmacists out there. I trust my current one. And I trusted the lady I had in Las Vegas, who I could not understand a word she's like. I got like every fifth word. She was Korean, but oh my God, she was the sweetest person on the planet. This is during like COVID. And every time I'd walk in, she was like sliding me tests under the counter, you know, and like gloves and mask, and not even having me sign. I don't know who the heck was paying for all this stuff, but she's like, get sick. I don't want you to get sick.
That's cool. That's
so
cool.
She took great care of me. Valerie just put a good reminder. Please close the chat out if you have to, and go hit that little thumbs up, because we need as many thumbs ups as we can.
Thank you guys for every like and every comment.
And if you're not subscribing to this, to the network yet, I would ask you to go and subscribe to it as well.
Absolutely.
That would help us out a lot. YouTube is a whole different critter for me, and I don't understand all of it, but I know.
Well, YouTube's been just reinvented. So this algorithm has just evolved itself.
I don't know. But I want to keep doing what we're doing, because next Thursday, we're focusing the whole Thursday on community. We have a lady from the East Coast going to California to get a once in a lifetime thing. And a lady in California was there to help kind of show them around and help take care of stuff. And they wouldn't have met up or teamed up if it hadn't have been for Invisible. I didn't do a damn thing. I had no control over it. They set it up because they figured one was on one side, one lived out here. Hey, I'm flying out there. Hey, I'd love to help out. And I want to bring them on so they could share their lived experience with it, as a reminder to just how powerful y'all can be in this community. We've had people get diagnosed really rare diseases diagnosed after seeing people on lives. And then I want to make sure this community is still understanding the power that they have, because this isn't something that I built. This is something that y'all built. Y'all built this thing.
When you're speaking on power, I'm going to address Carol here real quick. So, Carol, I see you in the chat. So if you really want to know the most powerful thing that you could do to help grow this community on YouTube, so yes, the likes are super good. The subscriptions are very good. You guys are killing it watching the whole video. The truly one last thing that's needed are actual comments on the video after the live. I hope that makes sense. So right now you guys are commenting in the chat, but the comment section stays empty after the live goes off. So for those of you that stick around, it'd be great, since Keith is pulling a show on community next week, maybe bomb the comment section with just the word community. So if each person would have put something like community in the actual comment section, not the chat after the live is over, that's what really strikes YouTube for us.
So basically, once we finish and wrap up with victories here and we sign off for the night, refresh your browser.
Correct.
If you're on your phone, or close out of the app on your phone.
Correct.
Then come right back to it.
And make a comment on the video.
You go to live again, and the video should be processed relatively quickly. And then leave a comment on the video that's there. Just write the word community.
Correct.
And the more we get at that, the better YouTube will like it.
Because right now our lives, we're on fire in the chat, but the comments stay empty.
Yeah. On the videos? Yeah.
Correct.
Yeah. Yeah. There's some pretty good comments on some of the podcasts that we
Oh,
did.
yeah. No, those are total difference. Right.
But yeah, I understand. So I hope that's clear to y'all, because it's as clear as mud to me. Right,
and thanks for asking, Carol. Appreciate that.
So
she says, okay, cool. Thanks. Makes sense. Well, what makes sense makes growth.
There you go. Means we can all stick around a little bit longer. So before we get into victories, does anybody have any more questions about, or any events you need to get off about insurance tonight? Toss them in now, and then we'll get into some victories, because hopefully somebody's here that has some victories this week. I had one today that I'm excited about, that I'll be happy to share, but I'm hoping more people have victories too. So why do we do victories? It's because a lot of us have losing streaks going on, and we need to live through somebody's victories. We need to see victories are possible. Other people's victories give us hope that in the very near future, we're going to have one as well. So if you've had a victory this week, whether it's a shower, whether it's you found your unicorn, whether you went to your pain doctor and it was a good appointment, whether you went to your PCP, whether you got to play with your grandkids, or you got a new puppy, or you're able to go outside and just get some vitamin D by sitting in the sun, whatever it is, please type it in the comments right now so we can get some victories celebrated. I need some victories in my life in a desperate way. Crap, I had the car breakdown. We lost one of our pups last week, and then I spent over $2,000 in car repairs in the last 36 hours. Wow. So I could use a victory. So if anybody has a victory, please, please do. Kimberly, I haven't had vanilla. I am stuck on the watermelon version of Red Bull right now. So Forky said, only suggestions: if you don't give up if you get denied. Be polite and keep calling. That's it. So now they're talking more about Red Bulls than anything.
I know. I was shocked. I didn't know they made a vanilla Red Bull yet.
Neither did I. Kate said she had the best tacos this week. Fish and shrimp. There you go.
I like that.
That's good.
I like that.
Buck says my victory is my hubby scheduled a plumber.
I like that.
I don't know, but I'm hoping that situation gets taken care of quick. Natasha, I made it to work and didn't miss a day. Week 2 of a broken tailbone.
Ooh.
What a nightmare.
Oh.
Kimberly, I went on a wonderful walk today with pup and hubby.
That's cool.
That is awesome. Is that the same? Pup?
Good one.
Sorry, I'm not trying to be mean there. Leslie said, I spent the week with an amazing human and a unicorn pup. You did, and I cannot wait to share that story. Jennifer said, my 3-day migraine streak ended today. Laugh out loud, hoping it doesn't come back tomorrow. I hope and pray we didn't jinx it.
Good
Cynthia,
job. I'll celebrate that with you.
Yep. Forky said, I made it to the live. It didn't go to bed early to escape. You guys helped pull me out of some grief, darkness I'm dealing with. The Forky, we're always glad when Forky's here.
Truly.
Forky is like a bright of light, like a ray of sunshine for me in so many ways. Even when Forky's having bad days, she finds a way to make me smile. I'm so glad you made it tonight. Cynthia said, we just had to do the same with the vehicle. I managed to be outside for a while 2 times this week without a major MCAS attack. Hallelujah. That is awesome. Erica survived the 6.5-hour drive from our youngest son's wedding on Saturday that didn't know I was coming. You surprised them when I showed up. I pulled up and said, I heard there's a wedding.
Wow.
How awesome is that? That is so cool.
That is.
Judy said the pellet stove died again 2.5 weeks after getting it fixed, but didn't blow anything up.
That'll work.
I'll take that as a victory.
That'll work.
I like having you around, Judy, so I'm glad you didn't blow anything up because that would have been a nightmare. That would be tough. Though, could you take it outside and take a sledgehammer to it? Would that make you feel better?
If you do it, video it.
Yeah,
And
please do.
Send it to us.
Like that, I made my therapist start drinking after my appointment today. At least I'm not the only one that does that. I tell you, I'm just going to start bringing gift certificates to my therapist, when I start seeing her, because I know that's what she had straight. She doesn't see anybody after me. She sees me at 10 o'clock every other Thursday, and then she is gone. Like the door is locked at like 11:15, and she disappears. She goes home because of the trauma that I dump on her, So Judy says she thought about taking it outside with a sledgehammer, kind of like the movie Office Space, right? With the copier.
Yep.
Didn't they do that to Isn't it Good to Be a Gangster? Isn't that the song that they were beating it up to?
Yeah, I think that was.
So yeah, that's awesome. So next Thursday we'll have 2 people with me. We'll have y'all in the comments. We'll have Kevin here keeping us on track. We'll have Evelyn answering the important questions in back.
The full Invisible No More experience.
It'll be the full Invisible No More experience.
I can't wait. I can't wait.
I did my best with the comments, keeping up tonight. If I missed something, please let me know. The delay is all it is. We just got to live with the delay, and there's nothing we can really do about that, unfortunately. But I think we kind of did it okay tonight. So I want to say thank you to everybody that made it tonight. We're going to wrap up just a little bit early. Apologize for that, but I made it here.
Glad to have you. Glad to have you.
Thank you to Kevin. Thank you for Doc. Thank you for Ellen. Please, y'all, once this video, the live is done, reset everything, come back and leave a comment on the video itself. Just type in communication. I love you guys, and I really do hope that tomorrow is at least a little bit better for you. Y'all be safe.
Take it easy, guys.
Peace.